All right, earlier on we took you to the Kgalema Motlanthe Foundation's virtual dialogue, which they're hosting this afternoon with lecture by guest lecturer Dr. Pali Lehohla, Chairperson Professor Firoz Cachalia, and of course Patron, former President Kgalema Motlanthe on COVID-19. We'll take you back to that conversation.
Is an essential requirement, and we've seen how in our own country this COVID-19 has exposed the fact that many communities don't have access to potable water. They struggle to therefore follow the guidelines, the World Health Organization guidelines that, people should wash their hands with soap and so forth and sanitize and so on. Now, if people do not have potable water, access to potable water, that means our problem of nutrition, child mortality in relation to health, care issues is quite acute. And so I'm raising this in relation to how SADC should organize itself, because I'm aware that at the mouth of the Orange River, as the Orange River decants into the seas, into the oceans, between Kinshasa and Brazzaville, there's a whole pool, a whole lake, if you like, of clean water, which over time gets salinated and it becomes part of the sea. But it is available for all the time at the mouth of the ocean. Now, that is water which does not belong to the Democratic Republic of the Congo, nor the Congo-Brazzaville. And so if SADC was to address specifically this issue of water scarcity, it would mean having to pump water, clean water, from this lake which forms at the mouth of the Congo River, and pump it through Angola, which does not have a problem of water scarcity, and into Namibia. It can be canaled or piped into Botswana, into South Africa, into Zimbabwe, and coupled with how we address the land question, this could go a long way in placing vital assets in the hands of communities, and therefore help to address multidimensional poverty. Now, the other point where I'm trying to avoid repeating what Professor Cachalia has raised, but where Dr. Lehohla ends with emerging policy consensus, that if we are to strengthen that emerging consensus, we got to look at how social compacts that are effective and work up to this day were formed against the backdrop of a deep crisis. And I just want to cite a few examples. Finland, Denmark, the Scandinavian countries, who, during the Second World War, essentially, were very, very poor. Their infrastructure was damaged. Finland was even burdened with the responsibility of having to pay war reparations against the Soviet Union, which had actually invaded Finland at the time. And if you take Germany of the time, they lost the war. They were burdened with the war reparations. damaged, completely ravaged infrastructure. And that's what inspired them, that deep crisis, economic crisis, to then fashion what they call the codetermination system. Now, elements of the codetermination system provides for equal say between corporates, organized labor, and the state. So they were able to form that codetermination system, and it functions up to this day precisely because the risks were shared and continue to be shared. So so employers enjoy the flexibility to reorganize the workforce, but in between jobs, workers have a secured network that allows them to continue living decently and with protection in terms of access to health and education and so on. Now, it is those elements that are missing in our emerging consensus. How are we going to ensure that there's a sharing of risks? So we know that the private sector, employers always complain about the labor laws not allowing them flexibility in terms of how they reorganize the workforce and so on, which is perfect and makes a lot of sense. However, what is missing in that is what protection would be given to working people in between jobs, as well as in terms of the access to health. So the question of universal health provision becomes very important, an important factor in how this consensus can be given effect to. So you need, and there are few countries in the world. I think it was on the 13th of this month, the director of the London School of Economics and political science penned a wonderful article which, as I understand, was actually an abstract of a book on social contracts that's going to come out in the year 2021, next year. And in it, she does a comparative study of how, countries that allow for, are grouped in terms of, allowing for the flexibility in terms of how labor is, employers are able to organize and adapt the workforce and the protection, social security network that is in place. So she, for instance, categorizes the US that there's lots of flexibility, zero protection in terms of social security network. Now, then countries like New Zealand, Australia, the Scandinavian countries do very well in that regard. And then there are countries in Africa and South Asia and Latin America where there is low flexibility, low protection. And so in those kinds of countries, it is difficult to emerge with consensus which basically translates into a social compact or a social contract. And I think, it's worth looking up that article. It appeared on last week, Monday, on the 13th, in Business Day. And the author is the director of the London School of Economics, Political Science, and her name is Shafiq. I think that's her surname, Shafiq. But all I'm raising is that Dr. Pali Lehohla has really helped us to, adopt a methodology which helps us to measure and identify weaknesses in comparative terms, and also therefore suggestions on how to remedy these weaknesses that have been laid bare in more stark terms under the COVID-19 situation. Thank you very much, Kathy. Those are the points I thought I needed to raise here.
Sure. Thank you so much for that, former President. So what we'll do next is we're going to open for our Q&A session. I'm going to ask all of our guests, if you go under the chat group or the participants, you'll have the option of invite, mute me, or raise hand. And if you can please raise your hand on the actual Zoom app, and we'll see those raised hands and we'll be able to come to you. Alternatively, what you can also do is that you can send your question to the chat on the actual app, and just under that, if you can just put question at the top of that, and we'll know to note that whatever it is you're sending through is a question, and we'll read it off the chat. Alternatively, of course, we also have our social media that's running this afternoon. You can tag us on Twitter at Motlanthe.
All right. So, of course, former President Kgalema Motlanthe has had his say there, as, of course, his foundation, the Kgalema Motlanthe Foundation, hosts a virtual dialogue on COVID-19. But a number of issues, of course, raised by the former president, from water scarcity on the continent, obviously adding to issues relating to COVID-19, as it puts into question the issue of hygiene, which is one of the major issues that are said to help with regards to the spread of COVID-19. He also spoke about emerging markets and emerging consensus, sharing of risks when it comes to the private sector as well as government, where labor laws are said not to allow flexibility for the private sector, and of course issues relating to access to health. So a number of issues coming together there, as the issue and the topic, of course, was that of COVID-19. So that is the Kgalema Motlanthe Foundation's virtual dialogue on coronavirus then. Right. Well, Reuters is reporting that the South African government, we'll come back to the story after the short break, it is in your